Welcome, everyone, to the Mind Viking. I am your host, Eric Engberg. And if you haven't already done so, please subscribe to my YouTube channel by clicking on the subscribe button below. And while you're at it, please click on the little bell icon so you're notified anytime a new episode goes live. In this episode, I have as my guest, Mr. Robert Madeja. Robert is Senior VP of Market Development for a top real estate team here in the Austin area. And prior to his current role, Robert spent nearly 15 years as an engineer in the tech industry. He has a bachelor's degree from Virginia Tech in both chemical engineering and chemistry with a minor in mathematics. And I asked Robert to come on the show today to share with us his concerns over the mainstream media's fear-based reporting of COVID-19. He will also discuss his thoughts on the dangers a free society can face when their citizens are required to sacrifice their constitutional liberties for the sake of the greater good. Robert, welcome to the show. How you doing, man?
I'm good, Eric. Appreciate you having me.
Absolutely, man. Absolutely. All right. You ready to get down to business?
Yes, sir. I'm excited to talk with you.
Yeah. All right, man. So I think it's important that I first say that in no way is this interview intended to diminish or to minimize the impact that COVID has had on the world and our country. It has affected people that I know in a very real way, and it is something that I have and will continue to take seriously. That being said, here's the main reason why I asked Robert to come on the show. The idea that COVID-19 is somehow being propagandized to push an agenda does not set well with me. I can't tell you how many times I've heard or read on social media, you know, when things get back to normal, I can't wait to do this, or I can't wait to go here. And it wasn't until I started paying closer attention, primarily due to Robert and the questions he and some others have been raising on social media, that I started to ask myself, well, how do we define normal? And more importantly, who defines it for us? And I think for most of us, well, it's the media. It's the medical experts and the government officials that we see on TV. We will know everything is okay and back to normal when they tell us, right? But what if the powers that be don't want us getting back to normal? What if having a society gripped in fear is just what they need in order to advance some pernicious agenda? Well, that, my friends, is a scary proposition. Robert, you have anything you'd like to add before I get to my first question?
Yeah, no, I think you summed it up well, Eric. I think these are things that I know myself and many like-minded folks. And one thing I will say is, one thing that I do find is encouraging is I see a lot of people beginning to wake up. There's still, don't get me wrong, there's still large swaths of the population that still look at this the same way. If anything, the fear and the hysteria has done nothing but grow in their minds. But I will say it does appear to be a good subset of folks. The more conversations I have, the more questions I ask, folks that seem to be wisening up to all of this and say, wow, so much of this just doesn't stir the Kool-Aid. You know what I mean? I mean, it just doesn't. And to your point, you said it well. We would never seek to diminish the folks that have lost their lives to this. And that's where, I always try to tread lightly in what I'm saying. You're not, discredited or, saying anything ill, certainly, of folks that have perished from this, that have been affected, long-term, their health and et cetera, or lost loved ones. But at the end of the day, I mean, again, you summed it up so well. It's about our response to all of this. And 6 months ago, nobody really knew a whole lot. The uncertainty was worse than anything else at the time. But man, 6 months into this, for whatever it is, 5, 6 months in, we know so much more than we did, and I just can't see any scientifically backed reasoning to continue, not only in the hysteria that we've been in for the last several months, but for that to grow in the minds of so many folks. So, no, again, I think you said it all very well, and I'm excited to dive in a little bit more on all this.
Yeah. So let's do that, man. So you think there's potentially more going on here than what we're being told, and we will definitely get to that here in a few minutes. But first, walk us through the first couple of months of what COVID looked like for you. How did you and your family first react to it? And then, given you have an engineering background, you're a numbers guy. Data analysis, data processing is what you're trained in. Take us through your analysis of the data that first month and a half in.
Yeah, no, absolutely. And I want to throw a disclaimer out there that I may have an engineering background. I've taken a lot of stats classes, but I'm not a doctor. I'm not an epidemiologist. I'm not any of the above. I've never studied infectious disease, anything like that. I'm just a free-thinking, analytically minded citizen that loves this country. I love my Lord and Savior, Jesus Christ. And that is the priorities under which I live my life. But I always call into question when I see folks that respond only on emotion, and only if you ask questions and dig in, all you get in response are talking points. To me, that's always suspect. Doesn't mean I treat them differently or love them any less, but it's suspect. But to go back to your question, yeah. So when all this kind of started coming down, man, like I told you, or like I mentioned earlier, the uncertainty was worse than anything else. I'll always remember when all this started, all the shutdowns started happening. We were in Houston, my family and I, for my sister-in-law was supposed to be getting married in May, and we were in Houston for a couple shower that my in-laws were hosting at their house, and there was probably 75 to 100 people there, and that was before all the bans of large gatherings started coming down. And there was a lot of talk about it, obviously, at the time, but everybody's kind of like, my gosh, what's going on? And this is all just so crazy. And driving home from that event back here to Austin, we were heading into spring break. And I always remember this moment. We're in the car with, I have 3 young kids, 3 kids under 7. And again, we were heading into spring break, and we were getting calls and text messages automated from the school district here talking about how schools were going to be shutting down. And we were just literally watching everything kind of just, kind of spiral all very quickly, as we know, in just a couple of days. I mean, society basically came to a screeching halt. And everybody kind of looks around and is like, oh my gosh, like, is the world ending? What in the world is happening? So that carried on, for the first couple of weeks. And I'll be the first to say, man, when those models first started coming out, and Dr. Fauci and Birx are up there, and they're showing these complicated graphs and things, and 2.2 million people are going to die based on the IHME model, right? The Institute for Health Metrics and Evaluation, which I'm sure we'll talk about more later. But that was that, and the model out of the UK, the Imperial College, right? Those were the 2 models that basically these doctors and these health experts were filtering data from Europe and China and other places into these models to project how many people, unmitigated, could potentially die of this disease. And they're throwing out numbers in the millions, right?
Yeah.
And I'm looking at that and I'm thinking, well, shoot, I mean, if we really lose 2 million people, I mean, that's almost 1% of our population in this country. We haven't seen something like that in 100 years. And the world hasn't seen something like this in 100 years. So more than 100 years. So it's, there's potentially cause for concern, right? So I'll be the first to say, we were hesitant to go anywhere, just like anybody else. But having said all of that, I could never shake, and this is probably just the cynic in me, because I am just in my flesh, right? I tend to be a cynical person. I trust but verify. I don't just take what I see. I take everything I see with a grain of salt until I can confirm it for myself in some way.
Yeah.
And that may sound exhausting to a lot of folks, and it is, including people like my wife. It's exhausting, but it's just how my brain works.
Yeah.
So, we're kind of, we're going along in that way for the first few weeks, and then it doesn't take long before, you have the Surgeon General up there, and you have Fauci and Birx and the coronavirus task force and all these officials, these people that I never heard of Dr. Fauci or Dr. Birx before. I know Fauci was very involved in the HIV, when that all first became a thing, back whenever that was, back in the early 1990s, I believe it was. But nobody had ever heard of these people, and all of a sudden we're all listening to these folks that we don't know. They're unelected. They're up there telling us how we're going to lose over 2 million people in our country, and we have to shut our entire lives down, effectively close our businesses, take our kids out of schools to prevent that from happening. Well, okay, again, we've not seen something like this in our lifetime, certainly, and really in modern history. So there's really at the moment, we're thinking, okay, well, if this is what they're saying, so, this clearly is going to be, this could get bad. And we had the Surgeon General and others, as I said earlier, up there basically saying that. Like, I can't tell how many times I watch these press conferences and I hear our Surgeon General, the nation's top doctor, saying it's going to get bad. It's going to get bad. It's going to get bad in places like New York and LA out of the gate, right? And then the Trump administration sent the Comfort, the Navy ship to New York. He sent another one to LA. And he went and he saw the ships off, and it was this big thing, and it was just like, oh my gosh, like people were literally going to be dying in the streets the next week or 2 or 3. And the next week would come and go, then the following week would come and go. And yes, people died in New York, especially, right? That people died there. I'm not going to diminish that. But we now know, fast forward to present, right, that half, not 10%, but half of the people that died in New York died in nursing homes. And that was largely due in part to the politics of the New York governor and others that basically forced these nursing homes to take positive COVID patients back in their nursing homes, where it spread like wildfire.
Yeah.
And we now know, of course, and we knew somewhat at the time too, based on Italy's data and other countries, but we knew that this thing affects the older population disproportionately. It does so significantly more than the younger population, and certainly children. But yet we were forcing these nursing homes to take these COVID positive patients back, where, of course, it spread like wildfire, and people died by the thousands a day.
Yeah.
But all the while, the Navy ship in the New York harbor sat empty. I don't believe it saw more than maybe 100 COVID patients in the entire time it was there. It sat there for 3 months.
Yeah.
And it didn't see a single patient. So I'm watching all these things happen. And then in conjunction with that, the model predictions start to come down within the first few weeks. And I'm not saying it went from 2.2 million to 2 million. I'm saying it went from 2.2 million to 500,000, right? Same thing happened in the UK. They were saying it was going to be, I don't recall what the numbers were, but the point of the matter is it was orders of magnitude down, right?
Mm-hmm.
And it wasn't orders of magnitude down 6 months after, it was orders of magnitude down 3 to 4 weeks after the initial projections were made. So the question then is, how are we trusting these models to predict the outcome of this thing when they're clearly way off base? And more importantly, we're making catastrophic policy decisions based off of these terribly flawed models. And then, fast forward a few weeks after that, the guy that's behind the Imperial College model in the UK resigned his position because he was caught violating the COVID restrictions and he was sleeping with his married mistress. Right. What? So these are just, So these are just,
oh my gosh.
Just a couple of details. Right. And now, of course, him sleeping with a married woman doesn't necessarily, it's not, in conjunction with the flawed model. But the point is, the flawed model was so off, and the dude's like, I'm out. Like, I'm distancing myself from this as much as possible. We've ruined a lot of lives and livelihoods because of this flawed information system.
Yeah.
And, kind of the rest is history. So,
yeah, I didn't know that, man. Yeah. Last time you
yeah.
and I talked, that was,
Yeah, no, I do a quick Google search of that. I mean,
Yeah.
I'm sitting in front of my computer now. I can look. I don't recall the fellow's name, but folks can Google it. These are all things that are, it's all out there.
Yeah.
It doesn't take. And I think it's another, misperception for a lot of folks is that they think that, doing, the research and thinking for yourself requires all this time. And the reality is, it's the exact opposite, right? You can, as we know, in the days of the internet, right, there you have all the information at your disposal. I don't have to rely on what I see on social media. I can do a quick search on the CDC website or some other legitimate source to cross-reference the things that you're reading and seeing. But most folks don't do that, right? They just they ingest what they hear. It stirs up some kind of emotional
Guilty. You're talking about
stirs up some kind of emotional, thought or reaction or whatever, and then that's their opinion, and there's no coming off of it.
Yeah, I see that. Yeah, I see that in many different things, politics especially. But hey, man, so we are recording this interview Friday, August the 27th. And last Saturday, August the 22nd, you shared a news clip on your Facebook feed titled, "Austin Public Health Moves Away from COVID Hospital Admissions as Key Indicator for Risk Stages." And then in the article, it goes on to say that the interim health authority said his office is working on moving away from hospital admissions as their key indicator for stages of risk-based guidelines, and instead may look at the positivity rate and new cases for thresholds. So, Robert, you included the following comment when you posted the clip, and I'm quoting APH, which is Austin Public Health, shifting the goalpost yet again. How many is this now? Meanwhile, schools still closed, businesses still struggle, countless out of work. If the threat is real, then the metrics don't need to constantly change to fit a narrative. Now, Robert, you've pointed to the shifting of the goalpost in several of your posts. Explain to us what you mean by this and the different shifts that you've seen over the last many months.
Sure, Eric, it's a great question. So, as everybody will recall, back in March, all of this started with 15 days to slow the spread, right? Do we remember? We remember those words well.
Flatten the curve. Yep.
Flatten the curve. Well, what does flatten the curve really mean, right? So flatten the curve, as we know, it's an epidemiological curve. And again, I'm not a doctor, but I understand simple charts and graphs, right? And the theory is, if we all stay in our houses and don't go anywhere for 15 days, we will not overwhelm our health systems in such a way that that there's not enough ICU beds or there's not enough hospital capacity to adequately care for the folks that contract the disease, right? We saw that in some countries like Italy and other places that were particularly hit very hard. Now, I believe wholeheartedly there's specific reasons why places like Italy got hit harder than most other countries per capita, right? You can't look at just case numbers and numbers of deaths, because Italy has a vastly different population size and demographic than the US, for example, and many other European countries. So it's not all on equal footing. That's why you have to look at metrics like per capita and et cetera. But we know that the initial conversation was 15 days to slow the spread, okay? Now, meaning that we can flatten the curve in terms of numbers of hospitalizations per day and how quickly those will add up and back up to the point where the systems get overwhelmed and people are dying in the streets. That's the picture that the media was posting and portraying at the early onset and did for several months throughout this, as we'll recall. scared people absolutely to death, right? So of course, folks are happy to do their part and stay in their homes. And we did exactly that personally in the first few weeks. If we're thinking, all right, if folks are going to be dying in the streets of this thing, I'm not going to subject my family and my kids to this. I'm not.
And you even said that in the very beginning, before it was mandatory, you guys were wearing masks. I mean, you kind of took that on, that precaution on your own in the very beginning. So it wasn't anything that you didn't take seriously, when the news came out initially.
Yeah, no, that's a great. No, I'm glad you pointed that out. And I can't stress that enough, right? I remember the first few weeks before the masks were even a conversation. In fact, when the Surgeon General was telling people to not wear masks, and right, I posted an article on my page to that effect as well, as you may have seen a few weeks ago, just reminding folks of the disparities, right? You had Jerome Adams, the Surgeon General of the United States, posting on his Twitter account, and it's still up there. In fact, he's never deleted it. And I'm not going to sit here and say, that I don't think that I think our Surgeon General was trying to mislead people at the time. No, that's not at all what I'm saying. But all I am saying is there's a tremendous disparity there over the course of just a couple of months. They need to explain to us why the disparity, right? So yeah, during that time when Dr. Adams was imploring people to not buy, and he was doing that so that people wouldn't buy them up so that the healthcare workers could get them, right? I totally get that. But the point is, he was either lying then or he's lying now, right? Because it's opposite. So which is it?
Yeah.
But yeah, during that time, before there was even discussions of folks wearing masks, I would wear a mask when I'd go to Costco or whatever, long before they were requiring them.
Yeah.
Because again, if this thing really is as lethal as they say it is, we need to take precautions. But it quickly became evident it wasn't even going to be a fraction of what they said. But kind of shifting back to your original question on, the goalpost shifting and all that. So we started with 15 days to slow the spread, right? And the metric was hospitals being overwhelmed, right? And we went along with that for a while. But again, you started seeing, like in New York City, they had the Comfort, the Navy ship in the harbor. Samaritan's Purse, which is a tremendous non-for-profit organization run by Franklin Graham, the Reverend Franklin Graham, Billy Graham's son. They set up a field hospital in Central Park, right? I mean, what a scene it was. These tents and this all these doctors from all over the world coming in because they knew New York was just going to be, who knew how terrible it was going to be.
Right.
But man, the weeks went on, and none of it all sat empty. For weeks, it all sat empty. And it doesn't mean that some of the hospitals in New York didn't have some trouble, and they did. I would never take away from that. But the point is, none of those, the field hospitals, the ships, all that additional capacity was never remotely touched. So from there, right, we realized that the curve, there was never, yes, there was a curve, but we never remotely came to the place where we needed to, or that, we even got close to the capacity being reached, right? Now, some folks would say, well, yeah, that's because of all the distancing we're doing and all the mitigation that we're doing. Yeah. But keep in mind, at the time, no one was wearing masks, right? No one, because we were being told not to. Now, yeah, we were all hiding in our homes, per se, unless you needed to go to Lowe's, Home Depot, the grocery store, Costco, any essential business, right? Which coincidentally is all the large corporations, Walmart, all the big corporations for your essential goods and needs, right? Mm-hmm. So are we to believe that the virus only spreads unless you're in one of those places?
Yeah.
Right? So how are we really going to believe that because we're not hanging out at the bar or whatever your social event of choice, gathering, that's the reason why people aren't dying in the streets, right? So as time goes on, it became very clear that we were never going to be close to even needing to flatten the curve, right? Because the curve, again, was limiting, overrunning of the hospitals. Well, that never came close to happening, even while folks are out, they're shopping, they're doing essential business, okay? Never came close. So, but then you started to morph that into 15 days became end of April, right? Mm-hmm. So 15 days, middle of March would have been end of March. Hey, we need to, and even the president at the time had come out and said early in April, hey, I want to have the country open back up by Easter, right? Which obviously never ended up happening. The task force came back out in end of March at the end of that 15 days and said, hey, we need another 30. Okay, we need another 30 days. So we go do this for another 30 days, right? And then some states, more of the red states, begin to open after that. But you started to see the metrics start to shift, right? It was no longer 30, it was no longer keeping the hospitals from being overwhelmed. All of a sudden, everybody was obsessed with the number of cases, right? Not even how many people are going to the hospital, but how many people are getting the disease, right? But wait a minute, we just spent all this time keeping people out of the hospital. Man, it's great news. The hospitals were never close to being overrun, like even in the hardest hit places. But yet, so now that we know that's not going to be a problem, we should be able to begin to resume some normalcy, right? You take some reasonable protocols. Maybe you don't gather and, you don't go to a concert where there's 10,000 people, maybe, and you're all shoulder to shoulder sneezing on each other, which candidly speaking, I don't like doing that, COVID or not, right? Like, I like my space, that's just
Right.
my personal thing.
Yeah.
But, the shift from keeping the hospitals from being overwhelmed toward people getting sick happened quickly, but kind of discreetly, right? Whereas you kind of looked up after a couple of weeks and were like, wait a minute, I thought we were doing all of this to keep the hospitals from being overwhelmed. Well, that never came close to happening. Hey, that's great news. Wouldn't we want to try to resume as much normal, especially economic activity, so that people's livelihoods and their businesses and things are not worse off, right? They're not more impacted as a result of these extended, restrictive policies. So that was kind of the initial moving of the goalpost. As far as Austin public health goes, that's a separate discussion. We can dig into that if you'd like, but in my mind, it's that principle of the moving of the perpetual moving of the goalpost to keep the narrative going along.
For the sake of time, I would love to take a deep dive into that. But let's get to the agenda. Let's talk about, your feelings that, the mainstream media, who, and I think most people would agree, I think, is anti-Trump, the mainstream media, and those in power who, don't want to see Trump reelected are in a way weaponizing our fear of COVID to do what? What do you think? What's your kind of theory on what the agenda might be?
Yeah, I think there's a couple of factors, but I think ultimately it's to assert control, right? Because a population, particularly folks that generally are freedom loving, as we are here in the U.S., fear is a very powerful emotion, probably more than any other, including anger.
Yeah.
It's very easy to get people to comply when they're scared. And in fact, there was a quote that, and this is a new item that this just happened in the last week or so. Dr. Birx, who is kind of right alongside Dr. Fauci there and within the task force that the president had set up, was, I guess, in a meeting with the Arkansas governor, or maybe there were several governors. I'm not sure exactly the context, but she made the comment that, if we allow people to understand and believe and know that 99 or more % of us are going to be fine, it becomes a lot harder to get them to comply.
Yeah.
Right. Google that. I mean, it's a very, I have the article. I don't know that I posted it on my page. I need to go back and look, but these are, and I'm sure, and to be clear, there's always context, right? I get very frustrated when people take things out of context. Yeah. I acknowledge that there is context to this. Mm-hmm. But at the end of the day, that notion is something that folks like myself have known has been going on with all of this for months. And, no matter what the context is, that is what their stance is, right? Now, whatever they say their intent is a different story. Although whatever they tell me their intent is, I'm not going to believe it because I don't trust these people personally. But the facts are what they are, and their behavior, thus to this point, would support that notion, right? And that really is that is their motivation, that is their intent, is to keep people in compliance as long as possible. And what you've seen is kind of a rise of this divide in this country of how do we move forward in this? You have, and it goes straight down party lines. You look at the states that are trying to reopen and trying to stimulate their economies and try to get things going. They are all red states without exception. And I don't intend for that to be a political comment. It is just an observation of the data.
Yeah.
Right. The data would tell me the red states are trying to reopen, the blue states are not. Why is that? Right.
Yeah.
We can opine all day long, but again, back to your question, it is an opportunity to push an agenda, to push a more big government, socialistic, even communistic agenda where everybody relies on the government, and it's anarchy in the streets. Now we've gone so far as, and it's happened here in Austin. It's absolutely tragic. The city council voted to pull $150 million from the APD. The only reason Austin is not Portland right now is because we're in a red state, right? And when the city government did that, the governor and the lieutenant governor stepped in and put the DPS, which is a state agency, to fill in the gaps, to make sure that we didn't have, and it's still not a pretty sight down there in Austin, but it's certainly not Portland or Seattle, right? And those are the differences. So, and that's how this stuff, it creeps in, right? We remove the police. You look back in history at regimes that have tried to do this type of thing. This is what the Nazi Party did, right? The Nazi Party did that very thing. I'm not drawing a parallel. I'm just saying that is, people can conclude what they want, but look at the history. Right, that's one of the tactics that the Nazi Party in Germany pre-World War II is what they did. They removed the police that were in place, right, and replaced it with their own personnel, their own folks, right. So, again, my intent in all this is just to share some of the thoughts that I've had.
Yeah.
I hopefully folks will draw their own conclusions on kind of what they think and where to go, but reality is the parallels are stark here, and the agenda is complicated, and I don't claim to have all the answers, but it is very clear to me that the intent here is to assert control and authority over people, and the only way to do that, especially in a free society, is to scare them to death.
Okay.
And bring them to their knees.
Yeah, and in a previous conversation that you had, something that you said, you touched on it here just a few minutes ago, that really resonated with me, and it just stuck with me, was in terms of maybe trying to push us closer to socialism, that and a question I asked you is, I just don't really know this, I'm not a very political person, what's wrong with socialism? Or why would maybe my question to you was, why would a government want a socialist type control or government in place? And correct me if I'm wrong, but I think you said something like you can't control a free people. And so if you're interested in controlling the masses, then socialism is one way to do that. And then the other thing that you said that stuck with me was, and again, you touched on this a couple of minutes ago, that there is a greater chance of pushing a radical agenda through that you wouldn't otherwise when the public is paralyzed in fear. And one example that you gave me was the Patriot Act. So can you just kind of touch on that real quick? Remind folks who I'm sure there's a lot that we'll be watching that know exactly what the Patriot Act is, but just, kind of a quick summary of, what the act is, why, how did it come about? What was it a result of? And how that, did take away from our civil liberties.
Yeah. So, I mean, in summary, the Patriot Act, right, was enacted after post 9/11, right? And it effectively, I mean, at a very high level, right? And again, folks can easily Google this and research it for themselves, but at a high level, it basically allows anyone to be charged as a terrorist and held against their will without due process if the government feels like it. That's kind of the very high level. There's a lot of nuances, a lot of specifics, right?
Yeah.
But at the root of what it is, the way I understand it, is just that.
But how did our government get away with that, man? I mean,
well,
why was everybody on board with that? Because I remember, 9/11, I remember where I was. I remember watching it on TV, all of that. I remember being scared shitless. And I was ready to do just about anything to protect my family, protect the country, to go to any extreme to make sure that did not happen again. Mm-hmm. So do you think that's kind of how, the majority of America felt? And hey, here's a perfect opportunity for us to, to put this in place and have the support of the American people. What do you think that's kind of what happened there?
Yes, I do. You had a combination post 9/11 of fear and anger nationwide, right? I mean, everybody immediately overnight became, I'm going to put a boot in your ass type of, as the country song goes, right?
Yeah.
Folks that would consider themselves terribly patriotic on September 10th, on September 12th, were friggin' patriotic, man. They were putting their, which is awesome. And that's one thing I will say, if there was any silver lining, if you will, to 9/11, and just, again, the tragedy of 9/11 and all that it was and the loss of life, it brought this country together in a way that I don't know I've ever seen in my lifetime. That's one of the key and stark differences I see between what we're living through now and what 9/11 brought on. Now, granted, 9/11 was not a worldwide event, right? 9/11 was a unique to the U.S. and a certain part of the country and all of that. But yes, 9/11 brought about a fear and, again, an uncertainty and a panic, right? You're seeing a pattern of emotion that made people want to act and do something. I won't say in haste, but in a more spirited way than they would have otherwise. That's why you see, so it's the same principle and concept behind the gun debate in this country. No matter which side of the gun debate you're on, you can't deny that every time there is a gun-related issue or a gun-related, tragedy, or someone shot, or there's a mass shooting, which, interestingly, we've not had, to the best of my memory, a big mass shooting in quite a while. I remember years ago, it was almost like a monthly occurrence. They were all the time, it seemed like. Yeah. But we can't deny that every time there was a mass shooting or gun-related violence, except, of course, when it happens in a city like Chicago, right? Because then the media won't touch it. But if it's something that suits the narrative, like a mass shooting, a kid taking a gun to school or whatever, what happens? The gun debate, it flares up. And all of a sudden, everybody wants to act, and everybody wants to do this and do that and make these changes and start restricting rights, right? By passing laws that aren't going to make any impact anyway on the real issue, right? Because all gun laws do or take guns away from law-abiding citizens, right? Criminals don't care about laws. That's why they're criminals. But, not to get off topic, but just as another parallel, right, of the concept that's at work.
Yeah. And I did do some research on the Patriot Act. And, it was passed into law. barely a month after, 9/11. The bill was very long, it was very dense, and few lawmakers read it in full before they voted on it. And some of the things about the act that were put into place, made into law. It allowed police to spy and eavesdrop on essentially police could then intercept phone calls, emails, credit card info, bank account info. It allowed government officials to use trap and trace devices. So, police or officials could break into someone's home or office and snoop around without their permission. It made it easier for the FBI to spy on Americans and search their homes. It was basically promoted as a tool to allow the government to catch terrorists through information sharing between the FBI and CIA. And those without terrorist ties would have nothing to hide. So if you're not a terrorist, then you really don't have anything to worry about. Critics, said, hey, this is a government using laws outside their original intent. It's unconstitutional. There's one section, that they felt violated the Fourth Amendment, the protection against unlawful searches and seizures. Section 505 violated the First Amendment to the right to free speech, promoted racial profiling, and the results were really unclear of whether or not it was truly effective on fighting terrorism. I saw one stat that it actually was more effective at putting, criminals, that were involved in drugs behind bars more than it was actually terrorist. So yeah. Okay. Yeah. So, and again, for the sake of time, here's something that I kind of want to discuss with you. So according to Reason TV, Michigan Governor Gretchen Whitmer compares today's fight against COVID-19 to the war against Nazi Germany, and she's prepared to use emergency powers on her path to victory. And here are some of and you were the one actually that brought my attention to this. Here are some of the restrictions Governor Whitmer put in place. You could be on the lake in a boat without a motor, but you couldn't be on the lake with a motor. You could go to Home Depot to buy lumber, but you couldn't buy flooring, flowers, or wallpaper. Landscaping businesses weren't permitted, where there is virtually no contact at all with clients. They show up, all the work's done outside, they can email them the invoice, no contact at all, but yet they weren't allowed to operate. So in this same video, Robert Madeja, a constitutional lawyer with the Conservative American Freedom Law Center and a co-plaintiff in a recent lawsuit filed against Governor Whitmer, was quoted as saying, "Tyranny has a new name, and it's called a pandemic." He went on to say, "Quarantine is when you restrict the liberty of the sick. Tyranny is when you restrict the liberty of those who are healthy." Would you agree with that?
Oh yeah. No, 100% no. And those are great points you raise, Eric. And, a couple of things I would add too to I think, Governor Whitmer, I think in my research and just following of the media over the last few months, has been one of the worst offenders of her folks, just their livelihoods, their freedoms, she made it impossible to your point, to, go to the hardware store and buy seeds to plant a garden. It was all basically, and it was under the guise of what's essential, right? Well, here's the problem with that. Similar to, as you said, we're going back in your research on the Patriot Act, you use a word like terrorist, and that's great, but the problem is there's a tremendous level of subjectivity. So what determines if you are a terrorist, right? And that was one of my biggest concerns with that is you can do basically whatever you want if the government thinks you're a terrorist. Well, the criteria is not terribly black and white. Same thing here with the essential, what is essential? And certainly even very red states like Texas have done, not to that degree, certainly, but they have determined that certain businesses, even to this day, August the 28th, as we sit here, non-essential businesses like bars, largely now, still aren't open, right?
Yeah.
And there's, some others we could list, but the whole point is the government in any capacity determining what is essential and what is non-essential.
That is scary.
It is very, very scary. And also, and this includes the mask mandates and other edicts that we're living under right now. None of it is legislated. None of it, not an ounce. The Texas legislature has not been in session all year. They're not scheduled to be back in session until January of next year. Why are we not calling an emergency session? And this is just in Texas, this would apply in any state. We're having people living under these. We keep hearing orders. I've heard that word more in the last 6 months I've ever heard in my life. All these orders we're living under. We don't live under orders in the United States. In a constitutional republic, we live under laws that are equitable to all, and laws are legislated, right? We have branches of government for a reason at the federal level and state level. We don't live under things like orders. Now, to be sure, the state governments in most states, Texas included, gives the governors some level of emergency power, right? And I know for a fact in Michigan that there are several state legislators that are trying to take away Governor Whitmer's executive powers. There's a few other states that are doing it as well. But these governors that have just run completely amok with these overly restrictive, regulations that really have no basis of any kind. Like the boat. I actually hadn't heard the one about the boat with the motor and the no motor. That was news to me. But again, why can I not go to Home Depot to buy seeds to plant a garden to presumably grow my own food? But I can go buy a lottery ticket. I can go get an abortion. Those are, and again, no matter which side of that argument you're on, those are relevant, right? The argument in the discussion here is essential versus non-essential. That's the discussion. And who determines that in a time like this?
Yeah. The more that I think about that, that angers me that there is, our government who is saying, hey, who gets to stay open and who has to close, and what are they basing that off of? And to your point, a lot of the, places that we can go are, big corporations, big companies, so is it that they have an influence, over, the what the, officials say or their decision making in determining who gets to stay open? You have to think, there's the potential for that,
I think if I could add one thing to that, I think you're exactly right. I think there's always going to be that big corporate influence. There's no doubt. But there is some level to which I'm convinced more than ever, you look at the businesses that were most harmed by what's happening, right? And certainly are not getting any kind of government bailout, much beyond a small PPP loan. At the peak of all of this, it's the small businesses, right? It's the small businesses that operate historically on a lower margin. I personally work for a small business, right? The small businesses, we know unequivocally, are the backbone of the American economy. It's one of the things that makes America America. The middle class is what makes, and I'm, as a proud member of the American middle class, the middle class is what drives the economic machine in the greatest economy in the world, right? The most wealthy economy in the world. It is the middle class. It is the small business owners that fuel this thing. And those are the ones that are most hard hit by these shutdowns. And they're also now the most hard hit in all the rioting and the looting. Sure, Target stores are getting looted and things, but at the end of the day, and I'm not taking away from that, it's devastating when a Target store in Minneapolis gets looted and burned to the ground. I mean, that's terrible.
Yeah.
But at the end of the day, is that going to put Target out of business? No.
Right.
But and you see news stories like this all the time right now, these small business owners furniture businesses and you name it, right? It runs the gamut. These folks in these cities like Portland and Seattle and, Kenosha, Wisconsin now, and countless others that are seeing this terrible rioting and looting and burning of buildings. These are family businesses that maybe have been handed down through generations, right? It's people's livelihoods. They've sank every penny they have, every minute of their days into running this thing, and it's gone in a day.
Yeah.
So to sum it up, my thought on that is this is a war against not only our way of life in this country, but of the middle class. The goal here is because you won't, as long as the middle class and the small businesses are running and the economy is doing what it's doing, America will always be what it is, or what it has been. Yeah. You remove that, we're no different than any other country in this world, where it's kind of it's a two-tiered system. And you look at places like California, that's already the case. Man, I mean, the middle class in California is all but obliterated out there. You got the super wealthy in Silicon Valley, and you got the homeless. There's no in between virtually, right? I mean, the middle class isn't completely gone, but it's been largely decimated out there.
Yeah.
And that type of thing will continue if we allow it to.
Yeah. Hey man, let's talk about the media. So how significant do you think the media's role has been in all of this?
I mean, to say the media is complicit, I think, is an understatement. I think the media is personally responsible for what we're seeing. The combination of that and folks just either refusal or inability or laziness or whatever it is that keep them from thinking for themselves, thinking critically. I think that we've all and I think that especially has been compounded by social media. I mean, yeah, of course, you turn on networks like CNN and MSNBC on the TV, and it's a dumpster fire, and it just is what it is. But in my mind, and the way I see it, is that's a small subset of the larger animal that is social media, and all the myriads of information that can be spread that's out there that's so terribly off or spun or whatever. And then in conjunction with that, you have all the big tech companies, Twitter, Facebook, and others, that are censoring basically anything that resembles a conservative thought, including the president himself. Now, to be sure, whether or not you're a Trump supporter, everybody can agree Trump's blustery on Twitter, right? Some people love that, some people hate it. But that's not the argument, right? The argument is, should we be censoring any opinion on media at all? Yeah. Because if we are, that gets dangerously kind of close to, we have free speech in this country. It's the First Amendment to our Constitution. You don't have free speech, you're not a free people. And when you have these media platforms that not only are censoring, right, and fact-checking anything that resembles a dissenting opinion, but they're doing it to the president himself. And again, whether or not you agree with his technique or his delivery or his opinions or his stances or his policies, you could be the most anti-Trump person in the world, but still, you should be still outraged at what is going on with the censoring, because you can hate a presidential candidate or a president or a politician all you want, but the minute we start drifting away from fighting for our way of life, which includes, perhaps most importantly, free speech, you're on a very slippery slope. Yeah. So yes, to answer your question, the media is far more than complicit. The media has driven this narrative, the hysteria, and airing these. There's so many reports early on, especially of like CBS News and others, showing videos that they were saying were in the U.S. but actually were in Europe, and of these people dying in the hospitals, and they were all later found to be have never even taken place here. It happened in a European country,
Really?
6 weeks earlier. Oh yeah.
Hmm.
Yeah. I mean, it's all just complete. But the problem is, I would personally look at that and say, okay, that's misinformation, right? But the problem is, misinformation has been a term that's been coined by the tech platforms for anything that is a dissenting opinion, right? You got a guy like Alex Jones. Again, I'm not saying I support him or I don't support him. That guy was completely banned and censored from every social media, every sizable social media platform. Excuse me, happened maybe a year or so ago. I don't remember the timing, but he's the InfoWars guy. He, has long been coined as a conspiracy theorist nut job, and no doubt. I mean, the guy he's definitely he's an interesting fella, but he makes some compelling arguments, and again, whether or not you agree with it doesn't matter, right? You can agree or disagree with anything. The
Yeah.
point is, when we start censoring and removing people's opinions and speech,
Yeah.
that is dangerous.
Yeah.
Right?
If we can't have free dialogue, in differing opinions, and the ability to be able to share those opinions, whether you like them or you don't, then yeah, man, I think that's dangerous. That is, I mean, free thought, free dialogue, that is what, the America that, that I love, that I want is, if I don't agree with someone, then, that's okay. I mean, but you're right. 'Cause I have, heard about that, about Twitter and some of these other sites, and, and one or two where, they were not only censored, but, then some of the credit card companies then would not allow any of, their credit cards to be used for the purchase of whatever merchandise this one particular, I can't remember who it was, but so, and that's a way almost of censorship, is, hey, you've got goods that you're selling. We don't agree with your stance. We don't agree with your position. And so, hey, we're going to yank the ability for you to, earn money, and
Yeah.
and profit. I should have looked that up before I said it, but
Well, I mean, it's cancel culture, right? Cancel culture is a new term that we're hearing a lot about now. And man, I mean, shoot, this is a small example. I even see it in my neighborhood. We live in a relatively conservative neighborhood, outside of Austin, and we have a neighborhood Facebook page, just like everybody's got a neighborhood Facebook page, right? Well, there's one fella in particular. Now, granted, he sometimes can get spirited with his comments, but it's not threatening death, right? Or something where it's like, okay, it blurs the lines between free speech and threat and verbal assault, right? But the admins on our Facebook group removed him from the group.
yeah,
Right. So it's just cancel culture.
yeah,
What a shame it is.
yeah,
Trust me, I have, many folks that I know that, are on the other side of the spectrum from what my beliefs are, that I'm just as good of friends with folks that I agree with.
yeah,
Um, you know, Dialogue can get tricky and be frustrating sometimes, but man, at the end of the day, like there used to be a time in our country where we could agree, but we would agree to disagree, and we'd still go have a beer together.
yeah, yeah.
But we've
I
and
miss those
COVID,
days, man.
yeah, you and me both. And COVID
Yeah,
has done nothing but just amplify that exponentially. I see how far we've fallen, off the grid, if you will, as a nation, and just our discourse and our ability to have constructive dialogue
yeah,
in just a matter of a few months.
yeah,
It's really a shame.
yeah. And I did a little research. You and I, when we last talked, I told you about this one day. My wife and I were sitting on the couch. She's got this week up, watching, getting kind of caught up on the news. It's ABC, George Stephanopoulos, and a commercial comes on. And man, it was the most terrifying COVID commercial that I'd ever seen. People were crying, everybody's wearing masks, doctors are pulling their hair out. There's patients, you don't know if they're alive or dead, they're on ventilators, it showed like a movie trailer of a horror film, it really did, and so I went looking for other similar type. I tried to find that commercial. I couldn't find it, but I found this one. This is a commercial that was actually, and it may still, I don't know, be currently running in Oregon, but it was titled, "Don't Accidentally Kill Someone." No words are spoken, right? So nobody's saying anything. There are big, bold, black letters on a yellow backdrop. So real ominous, just very, attention grabbing. And all you hear during the ad is the sound of medical equipment, presumably a ventilator keeping someone with COVID alive. And it goes from slide to slide to slide. The first slide reads, "If we don't stay at home, we will continue to spread the coronavirus." Next slide. 1.4% of all, and I'm not sure if I'm pronouncing this right, Oregonians could die. Next slide. An average person knows 600 people, which means 5 people could lose their lives. Next slide. Your kid's school teacher, kind of going through everybody that you might know. And then real quickly, one after the other: neighbor, friend, grandmother, sister, mother, partner. And then it ends on your child. And it pauses there. And then the next slide. It's up to you how many people live or die. Don't accidentally kill someone. Stay home. Save lives. Man, if you want to scare the shit out of someone, that right there will do it. What do you think, man?
Man, yeah, wow. I wish I could say that surprises me, especially in a state like Oregon. I mean, it's just, it is and again, when we talk about politics, it's so much. Politics used to be just liberal, conservative, Republican, Democrat, right? It used to kind of just be that simple. Man, anymore, it's become ideals. It's become worldview is kind of the term that I personally kind of use at this point in the game because man, at this point, like those opposite ends of the spectrum are so polarizing, are so different, that it's just so much more than just the simplicity of which side of the aisle you sit on. So it's just amazing to me how places like Oregon and others that, would lean more one direction politically, choose to fill their citizens' minds with, all that is propaganda, right? That's how that reads.
Yeah.
It is propaganda. That is not news. It's not entertainment. It's not, because, that's my thing, right? I guess the folks behind that think that they're doing right by people to get them to comply, right? So that people don't die. And again, man, back in March, April, if you ran an ad like that, I would never agree with doing something like that personally, but I could almost see it as a little more reasonable during that time, just because, again, as we'd said earlier, there was so much uncertainty at that time.
Yeah.
Man, there's not uncertainty around this anymore. I mean, there just isn't. We know the people that are affected by this. We know what the odds are, and that's if there's a good part of the number of cases that we have in this country, it's that anybody who's taken a stats class knows the more data you have, the more reliable it is.
Right.
It's called sample size, right? we know we have with whatever it is, 5 million cases or whatever documented in the US. I would venture to guess that it's many times that number, because of truly how viral the thing is, which truthfully speaking is a good thing, right? Because it means that the likelihood of dying is that much smaller. It's already very small by the recorded numbers, particularly for people under the age of 60. The reality is this thing does not attack everyone proportionately. And ads like that would suggest that it does.
Yeah.
And it also, what that does too, in my mind, is it takes it beyond the fear aspect. And what it does is it has a demonizing impact on people, making them, because most people would, well, not most, maybe a lot of folks would not, of course, I'm going to walk up to you and say, do you want 5 people to die? Who in the world is going to say yes to that question, right?
Yeah.
Come on. No matter what side of the aisle you're on or whatever your worldview is or whatever, no one's going to say, well, heck yeah, I want five people I know to die. No.
Yeah.
So it takes any other dissenting thought about all of this out of the picture, because what it's saying is you either comply or you want people to die. Right? There's no in between. Those are the ends of the spectrum. There's no other option. And that's when I say that the intent here is to control and get people to comply, which, going back to my comment from Dr. Burks, right? We know that that's what they're trying to do.
Yeah.
And this is one of the things that they're doing to do it, right? Is they're programming people to genuinely believe that this thing is way more deadly than it really is. First of all, even though all the data and stuff, I'm looking at them on my computer here, as we speak. I look at it pretty much every day, nationwide and here locally in Austin. The data speaks for itself anymore. But no one wants to look at that, right? Folks want to be told what to think on the whole. And it's just talking points. And by removing anything in between, where your only option is you either comply or you basically are you're complicit in the murders of 5 people that you know.
Yeah.
Those are the only options.
Yeah.
If you subscribe to that worldview, those are your options. Nothing else.
Yeah.
And to say that that's toxic and patently false, I think is certainly an understatement.
Yeah. Good stuff, man. So I want to talk about masks.
Sure.
So definitely a lot of controversy over mask. First, we're told by our medical experts that, they just flat out aren't needed, and we shouldn't wear them. And then the message changed that they now are needed. And in fact, if you don't wear one, you could be fined. So on August 25th, so 4 days ago from the date of this recording, Travis County did in fact move down to stage 3. But stage 3 still does require masks to be worn. So Robert, and you've kind of already touched on this, but if you want to add more, why the pivot? And if your suspicions are correct about there being an underlying agenda at play here, why is wearing a mask and everyone seeing everyone else wear a mask so important to their agenda?
Yeah, and it's a great question. I was looking for, there was it wasn't a meme, but it was just a screenshot of someone, and I'm having a hard time finding it, but it basically said, if masks work, allow us to go and visit our family in the nursing home or in the hospital or wherever. But if they don't work, take them off our kids, right? And that's just one kind of way to skin the cat, right? There's a lot of ways you can look at it. But at the end of the day, right, someone's lying.
Yeah.
Right? Who is it? Because we're playing both sides of the coin here. And that's just one kind of tangible example of that. And one other thing I'd say too, and I have them, again, I look at the key indicators from Austin Public Health every day, and I'm looking at it here now. And you made the comment about stage 4 to stage 3, which again, let's be clear, these stages are 100% arbitrary, right? They're arbitrary. They're not based on any kind of science, on any kind of anything. They're just, and that's why they can do things like change the metrics that determine the stages. So right as it stands right now on their webpage, on their dashboard, stage 4 is determined to be anywhere from 40 to 70 hospitalizations per day, daily in Travis County. Travis County, Texas has 1.3 million residents. If you have in the entirety of the county between 70 and 123 daily hospital admissions, you're in stage 4 by their criteria. So if you look at their dashboard, the last day by their metrics that we were in stage 4 was July 30th. I'm looking at it right here. July 30th is the last day we were in stage 4.
Yeah.
They just announced, and you said it this week, a day or two ago, whenever it was, that we're now in stage 3. The reality is, if you look at the trend, we're actually now almost in stage 2.
Really?
Yes. So
we've been in stage 4 a month longer than what their own chart says we should be in stage 4.
Yes, correct. And what that's allowed them to do is keep the schools closed.
Yeah.
Keep more businesses closed. Keep businesses that are open from operating at a greater capacity. Right. So, and again, my question here is, not only are all of these metrics, it's all arbitrary. The hospitals aren't. The hospitalizations are not. They are what they are. But defining stages by that is arbitrary. You would probably be led to believe that it has to do more with, relating somehow to hospitals being overwhelmed. But the reality is it isn't, because by the metrics, we were in stage 5 back in July 3rd. We moved into stage 5, and we were in stage 5 right at the edge for most of July, right around that 70 or more number. But we stayed right. It peaked, and again, I'm looking at it right here. It peaked on July 8th at 75.
Okay.
And then it went down and hovered around 70 until the 30th, and then has been a steady decline since then. But the question is, what does stage 5 represent? Does stage 5 represent that hospitals are going to be overrun? Well, no, we know that's not true. They set up a makeshift hospital at the Austin Convention Center to the tune of, a lot of money. I believe it was federal dollars that funded that. I don't know for certain, but the whole point is, we went through all those steps, did all that. Was it used once? No. Similar to New York and the other places like we talked about earlier. But then we moved into stage 4. We're now have been in stage 3 for all of July, or all of August rather. We're now so close to entering stage 2. And what do you see? Well, now we want to change the metrics that define the stages.
Yeah.
Right. Yeah. Anyway, that's just a side note on that. I don't want to get us too off topic here, but
so let me ask you, man, real quick.
I know you asked about the masks.
Yeah. Do you wear a mask when you go out? I'm sure people will want to know.
Yeah, of course.
Yeah.
Yeah. So it's, the way I've kind of looked at this, Eric, is I look at it as the same as no shoes, no shirt, no service. I wear it in establishments that require it, which now basically everywhere. I mean, not only is it state mandated, but it's mandated at the city and county levels as well. So, and what's interesting is, the governor's order, it is not a civil penalty, right? In other words, the law enforcement cannot cite you as a resident personally for not wearing a mask. What they can do is they can cite businesses for not requiring the mask. That's the way the order reads. Now, City of Austin has tried to do things like instill a $2,500 fine if that's not happening. Yeah. That's technically unconstitutional. It's also against the order issued by the governor. So whether or not they're actually doing that, I don't know. I can't speak to that. I don't technically live in the Austin city limits. But to answer your question, yes, I look at it as a no shirt, no shoes, no service. If I go to Costco, I know they require a mask. I wear one of those neck cover things that you have when you go fishing. Yeah. I've gone around and around with it. But that's kind of the conclusion that I've arrived at.
Yeah. Now, if you were in an area that didn't require wearing a mask, would you wear a mask?
No,
No.
no, I absolutely wouldn't. And I
Yeah.
think, it goes back to the original discussion around if there was some type of even reasonable data science specifics that would point to, hey, I am I am actually protecting myself or someone else by wearing this mask. In fact, there's mountains of data to the contrary. Um, I would I would do it, or I would look closer at it and consider doing it. I also would say that if it were not mandated like it is, I would also probably consider doing it in certain circumstances if I was going to be around older folks or whatever.
Yeah.
Here's the problem with it, Eric. Uh, the fact that it is being mandated proves that it's not effective. Because at the end of the day, if and that's in my mind that's more than an opinion. I think that's a reasonable observation and conclusion to draw. Because if a person sees the evidence, like, so in other words, wearing a seatbelt in a car, right? People can see a video of a crash test dummy going through the window if at a high speed, if they are on a head-on collision and they go through the windshield, if they're not wearing their seatbelt,
Mhm.
versus if they do wear it, then their likelihood of dying in that wreck is lessened. To me, that's compelling enough information, far beyond it being a law that I have to wear my seatbelt, right? To me, the compelling argument to wear a seatbelt is, if I get in a wreck, I don't want to go through the windshield,
Right.
right?
Yeah.
I'm not compelled to wear my seatbelt because the government tells me I have to, and if I get pulled over, I get a fine. That's not compelling to me. What's compelling is there is um, tangible evidence that wearing a seatbelt lessens your likelihood of dying in a car wreck,
Yeah.
right? So that's why, yeah, I mean, of course, that it's considered a minor traffic violation if you don't have a seatbelt on, but they're not going to take you to jail. They're not going to give you a $2,500 fine, right?
Yeah.
And why is that? Because they know people are free to make their own choices, and if they don't put their seatbelt on and they get in a car wreck, they could die, and that's on them.
Yeah.
Reason that they have to mandate them is because there is not remotely compelling evidence that it does anything to protect yourself or others.
Mm.
That's the
Mm.
difference in my mind.
Yeah. Yeah. I hadn't even looked at it that way. Yeah. No. Hey, man. So let's say I'm someone sitting at home. I'm watching this and I'm thinking, dude, let's just pretend you're right. Okay. What is the dang harm in wearing a mask? I mean, why can't you just go along to get along? What would you say to that, man?
It's one of those funny moments where I wish my wife was in here to hear that question, because I always talk about how, I operate under principles, man. Like, I'm a principled guy, probably too much so, if I'm real honest with you. My principles have made me miss out on things in my life. It can make me a little stubborn. But one of my principles that I live under is, man, no, I don't go along to get along. Doesn't mean that I'm out trying to start an argument. And all I'm trying to do is live my life. What I like to say is, man, just let me do me, and you do you. And for people like me, that's enough. Like, if someone wants to go out and wear a mask, man, not only will I support your right and your choice to wear a mask, I would I would fight against someone trying to mandate you to not wear one,
Yeah.
right? And that's where, again, the differences in worldview come in. Of, for someone like me, if I don't want to do something, I just don't do it, right? Whereas for someone with the opposite worldview of me, if they don't want to do something, they won't do it, and no one else should be able to do it either.
Yeah.
That is the compelling difference between the worldviews now. And that's why I say I try to not make it a political thing,
Right.
because yes, it is true that people of the former view tend to be more conservative. Folks of the latter view tend to be more liberal. But it goes so far beyond that, right? what's really at work here is the way your mind is wired and the way that you view the world. If something in your mind is wrong, it's not good enough for you to just not participate. It has to be wiped off the face of the earth.
Right.
Um,
Yeah. Yeah.
you know, so
And yeah. And, going back to cancel culture, it's not good enough that you apologize. You got to be fired. You got to, yeah, we got to just totally annihilate you. You can't make a mistake in this, climate, and you see it, happen to all kinds of, high profile people. It's just like, man, you screw up once, you're done,
yeah.
and they're very vocal about it and get ugly about it, and they shame you, and bam, they just, hey, we want you out, and we are not going to stop until you're out, man.
No, and one other thing, Eric, too, I'll say on the masks is, not only has there been so much conflicting opinion, I think I sent you that article of Dr. Fauci, he's kind of the face of this whole thing. I think we can all agree, like him or not. And, at the early onset, he had done a number of interviews where he was asked that very question of, should we be wearing masks? I sent you the article or the news interview. It was maybe a minute and a half long clip. He explained in several different ways why they're not effective. And he even went as far to say, it may make you feel safer, but it really isn't doing anything. I mean, I'm paraphrasing, but that's basically what he said.
Yeah.
And fast forward to now, yes, of course, he wears one and it's got the Washington Nationals logo and it's all cute. But at the end of the day, I'm not trying to get too terribly specific here, but the only masks, and we know this to be true, the only masks that are truly effective for yourself or others against this or any, respiratory contagion is one of those, either like a full-on respirator or one of those N95s. I have a number of friends that work in the medical industry. Some are doctors, surgeons, some are medical device salesmen, folks that are in the OR, they're wearing those N95s, right? Like those legit, like, dude, nothing ain't getting through this thing. But you can only wear it for a certain period of time because it's not good for you. Like it will harm you if you wear it for too long. Okay. So those are the only ones that really will be effective. None of us are certainly walking around with those. I see guys out in the store tying a bandana around their face that's all open on underneath.
I saw a kid, man. I got to tell you, man. I saw a kid. He had his hoodie wrapped around his head because he didn't have a mask, man. But he was compliant.
Yeah. So again, and you said, I'm so glad you said it because I was about to say the same word. You're not really having an impact on the transmission of the virus, but you are in compliance.
You're falling in line, man.
What is it? Yeah. What is it really about? Is it really about protecting lives per your ad that you cited earlier? Or is it about compliance?
Yeah.
To me, the answer is very clear. I don't know how you can look at any of the evidence that we've talked about here the past hour, whatever it's been, and conclude otherwise.
Yeah. You walk into a restaurant, and I think this is just the silliest thing, man. You walk into a restaurant, you have a mask on, and you sit down, and the second you sit down, you can take it off. You get up, you go to the bathroom, you got to have your mask on. It's just, it just seems silly, I mean, we do it, we're required to do it, and of course, all the waiters and waitresses, they've got to wear it. But even then, I've been to a couple of restaurants, man, where they're behind the bar, man, they put it under their chin, and they're handling food, and they're making drinks and all that. And then, they come around the bar and they put it over their, their nose. I don't know, man. Hey, I want to finish with this, man. So I know that you feel that we're going down a path that if you want to keep your rights intact, then somehow that makes you selfish and you don't care if people die. And you also said that you felt that was very dangerous. So why?
Yeah, no, I mean, great question. I think it goes back to, I'd point to that commercial. I want to watch that commercial, by the way, that you cited. I've not seen that, but, um, you know, we're basically being fed propaganda and lies that we're faced with one or two of those choices. And if I say things like I'm saying to you about the masks, right? As far as, no, again, I support your right to choose to wear a mask. You should equally support my right to not wear one. If there's and just let the evidence do the talking, let the data do the talking. I will determine what's best for me and my family, right? The government's role is to keep our rights intact.
Mhm.
It's not to make sure I don't get sick, right? If I die of somebody dies of a stroke, right, at age 60 or whatever, is that your fault? Is that the government's fault? Is that my neighbor's fault? I mean, if you have an unhealthy lifestyle, that probably contributed, or a congenital defect or whatever it is that caused your stroke. But somehow this is different. And it's somehow my job to make sure that you don't get sick. That's not how we operate. That's not how we operate in this country.
Yeah.
So yeah, I see it's a slippery slope. It's becoming a slippery slope of, and you said it well, how do you erode people's rights is you scare them to death, right? Because people that aren't scared and live and they're thriving in their lives, they're going to want to hold their cards close, right? They're not going to want to, no, you're not touching my right to do whatever.
Yeah.
That's guaranteed to me by the Bill of Rights and the governing documents of this country, of which I'm a citizen. But man, you start scaring people, it's a whole lot easier to start, and you're not gonna strip them all away in one day. It's a gradual chipping away at it, and that's 100% in my view, among other things that we're seeing in mass right now, is a gradual chipping away of and it's small things like the mask. Because I'll tell you, the next thing that's coming, regardless of how you feel about taking a vaccine for this disease, that's coming next. You already have states talking about it. Virginia, where I used to live, my wife and I met and got married there. We've been in Austin since 2011, but I went to school in Virginia.
Mhm.
I've lived in Virginia from 2001 to 2011. And, a good chunk of my adult life, they are all, the health officials in the state of Virginia are already talking about mandating the coronavirus vaccine statewide. So in other words, you won't be able to go to school, you won't be able to work, you won't be able to, go to the store, buy whatever your basic needs in life, you will not be able to do that unless you have the coronavirus vaccine. And that's just one example. Numerous states will follow. So there, in my mind, one of the things, the mask wearing is multifold. We could do an entire show on the mask wearing.
Yeah.
At the end of the day, they are warming people up to the idea of mandated action in response to this disease. The mask wearing, in my view, is like a warm up, right? Because you just said it, right? Like my wife and I have a date night tonight. We're going out. I know I'll have to put my mask on when I walk into the hostess stand, but the minute I sit down, I can take it off. Is it not as contagious at the table? And I get the discussion and the theory around it is, well, you're not walking around, so your likelihood of spreading it communally is less. Based on what? I mean, in theory, that sounds reasonable, but is that proven? No. Yeah. So if you're going to take steps like this to require people restrict and live their lives that differently, you darn well better have some data to back up why. And it just doesn't exist. And that's true outside of the mask argument as well. But
in any of our rights that are infringed upon, I mean, should require, I don't know what the word I'm looking for, but a higher standard of reason why we can't go to church. Why can't we purchase a firearm? those certain rights, and I know you talked about this last time that we talked. I mean, you're a staunch supporter of our constitutional rights. The Constitution was not this, this is not this fluid document that is up for interpretation. I mean, it can be amended, but that requires a process, legislation, that kind of thing. So there's certain rights that should require, I don't know, this is probably not the right description, burden of proof, just something, you can't just willy-nilly, say, hey, you can't do this, these are our rights, these just require just a higher level of reasoning behind why, they're being taken away from us.
Yeah, no, you're right. And it's, generally, and we said it earlier about these edicts and these restrictions that we're having to keep businesses closed, keep people in their house, keep people out of school, wearing masks, the list goes on. Not a single one of these, whatever you call them orders or edicts or whatever,
Yeah.
None of them have been through the legislative process. And that's on the state level, really in any state that's enacting these. They are far reaching beyond the emergency powers given to the governor alone. It goes so far beyond that. And no, you're exactly right. We live in a world now where everything is subjective, even words on a page, right? I would point to the discussion around Supreme Court justices, and we're talking about appointing a conservative judge versus a liberal judge. How does that even come to play? Right? Like, since when does a judge have a political leaning? A judge's job is to to issue a ruling based on the way the law is written.
Yeah.
Right? Now, if we don't like the way the law is written, we have a process to change it. It's not this, well, it's up for interpretation, so we can apply it however we like on the fly. That's not the way this country was founded. A lot of countries, currently in the history of the world that operate that way. We're not one of them. The Constitution, our governing documents, no more than the Bible, God's word, is not up for interpretation. It says what it says, right? Now, again, in the discussion around governing documents, we want to change it. Hey, we have a process to make an amendment. Make an amendment, right?
Yeah.
But when we don't do that because we know what the outcome will be, we just snap into place and issue these orders, and people are so quick to just kind of bow down and live by it and not think that, I'm not so sure this sits right.
Yeah. And that's kind of where I'm at, man. And that's one of the reasons why I reached out to you. That there was a little apprehension on your end, and understandably so. And we were finally able to come together, make this happen, because it was an awakening for me, and so I'm thinking, if it was an awakening for me, maybe it might be for others. Look at it just through a different lens, and maybe it's not what we're being told it is, and especially now, after chatting with you here for a couple hours, I think there's something else going on. I mean, it doesn't pass the smell test, and Hey, so what would you like folks at home watching this to take away from this interview, if there's one thing?
Yeah, I think my biggest thing is, I've been told that, by friends and folks that know me well. Obviously, anybody watching this certainly doesn't know me personally, and I would certainly, hope we wouldn't have any kind of snap judgments if anything I said, tweaked a nerve or was frustrating or upsetting or otherwise. I've been told that I can be very persuasive. I want to make sure that I'm clear. You invited me on to do this. I appreciate it. This has been good dialogue. these are things I think that, if nothing else, ought to just stir in folks' minds of, for say, just the average person that maybe, man, like I'm just so caught up my kids and my whatever my life circumstances are. I got a job I'm working that just consumes me, and all I really ever hear is bits and pieces here and there, and I just don't really know what's going on. I know it's all pretty crazy, but I guess we got to wear a mask when we go out to eat, unless have food in my mouth, and that's just the world we're going to live in. And I don't think about it. It's like, if I start there and then kind of peel back the onion, which again doesn't take much, you can quickly conclude that it's just, and certainly I'm not necessarily thinking that everything in the world that is going on is nefarious. I think we live in a time now where there is people of influence that despise our way of life, that despise our current, leadership, our presidential administration, and will truly stop at nothing to incite change and to assert control, as I alluded earlier. So,
yeah.
My main takeaway is my intent in any of this is not to persuade anyone. All I would ask anybody to do is, hopefully you heard something here that you hadn't heard before, and just
That's my hope.
Just go and do a quick Google search. You're like, man, I remember that goofy looking dude with the black glasses said that on that show, on Eric's show, and I'm gonna, that was interesting to me.
Yeah.
I'm gonna look more into that.
Yeah. That's truly what I hope comes from this as well. Is just awareness. And it's one of the neat things about having a show like this is I'm paying attention to people like you and to other people's and other people. And, it was like, again, light bulb went off. Man, maybe there's others that, have just been kind of blindly, just whatever the news says, whatever they read, from a reputable, news organization. Well, that must be the truth, and just it really has kind of caused me to pay closer attention, dig deeper, and simply not accept what I'm being told or shown as, at face value. Yeah. So, man, I appreciate you coming on the show, brother.
Enjoyed it, man.
I know being a successful real estate agent for a top team, your days are pretty dang busy, I'm sure. And then of course you got the little ones and all of that. Pretty neat to hear that you guys are going out to have a date night. I hope I see on Facebook tonight just people flooding our restaurants and in bars or whatever with date nights, man. That's what I hope to see, man.
I agree with you, man. Like I said at the start of the show, I see just in conversations that I have, folks that I meet, in our business, as we know, in the real estate world, you meet a lot of new people, a lot of conversations, and on the phone and in person and otherwise. And the tone is largely shifting, at least in my small little corner of the world. So I agree with you. I hope that it continues to grow in that way. And I certainly am not, would not call on anyone to go. So I guess one of the questions you'd say is, all right, as a result of this, I hear some things I were new to me. I research it. I start drawing my own conclusions, and I think, man, you're right. I don't agree with this. What do I do? What are my next steps? Right?
Yeah.
Do I go and protest on the state capitol stairs, or what do I do?
Yeah.
No, I think what you do is you have dialogue, like we're doing, right? Yeah. You have dialogue with others, and it's not a debate. It's not a you're right and I'm wrong. It's like, hey, have you thought about it this way? And man, to be sure, this is one of the most polarizing moments in history, certainly that I can ever remember.
Yeah.
In my 30 plus years, there's gonna be a lot of folks that they hold tight to living in fear and trusting what the news tells them and doesn't want to think otherwise. And hey, that's okay. That's okay.
And this content is probably not for them.
Probably not. No, you're right.
I think it's for someone who, like you said, busy lives, they've got families, they're trying to school their children, trying to keep them entertained and all of that. And, hey, I got 10 minutes. Let me pop on ABC, NBC, whatever. And then bam, you're just, hit in the face like a 2x4 with, hey, it's the end of the world. You need to be scared, don't go anywhere. Don't do this, don't do that, okay. All right. Well, okay, man, can't wait till things get back to normal, so.
One thing I'll say on that is funny. I saw a meme the other day one thing I will say, there's another silver lining to this whole deal. There is some meme gold out there right now. Just gold. But there was one that said, the phrase, when this whole thing is over, is starting to feel more and more like when I win the lottery. And I was just like, man, that is just so on point. Cause it's just like, and that's where I say, we want things to go back to normal, but you said it so well at the start of the show, man. Like what does that mean?
Yeah.
Right. What does that mean? That's very subjective. And the way that I look at that is, hey, yeah, there's a lot of people around me that are living their lives very differently than me, but I can make certain choices to where I don't need to rely on the government to tell me when my kids can go back to school or when I can do X, Y, and Z, right?
Yeah.
I can choose. Now, granted, it's harder to do that nowadays than it was 6 months ago, but you still have those choices to do that.
Yeah.
And that's the quicker you move in that direction, the less, of a weight it will continue to feel like. But yeah, I have, a couple of schools of thought on when this will end. At the end of the day, we all know a vaccine on this thing is going to be as effective or less than a flu vaccine. It's either going to make people feel comfortable enough to where, hey, there's something that may lessen the impact of this, or the media is just going to stop pushing the hysteria. I think that that'll largely be predicated on the outcome of the election. That's just my thought. Because what other reason would there be for this to have gone on, dragged on? And in the world of the 24-hour news cycle, something happens and 2 days later, boom, it's gone like it never happened.
Yeah.
Except for this.
Yeah.
And people liken it to, we haven't seen this in 100 years, and they're talking about the Spanish flu of 1918. And man, like, you had millions of people die in this country from that. Yeah. This isn't even on the same platform, the same reservation as that. It was also 100 years ago, we didn't have the medical system like we have now. So it's apples and oranges.
Yeah.
Oh yeah, but it's apples and oranges. But there's folks out there, in again, in an effort to continue to stoke the fear, would have you believe that it's on par with that. It's just not.
Yeah. Yeah. I'm sure there's going to be, a lot of people out there that, don't agree, with your take, and that's okay. Again, I want to thank you for accepting my invitation. I'm feel a lot better knowing that this is now going to be out there for anyone who may watch it and may be like me and kind of have felt for a while things seem to be off, and hopefully this maybe helps make sense of it for them in some way.
Yep. No, it's well said. I agree, Eric.
Brother.
Good to see you as always, my friend. Appreciate it.
All right, man.